Empty nose syndrome, or ENS, is a debilitating condition. Patients with ENS feel like they can't breathe through their nose, even though their nose looks open. It's a paradoxical condition. Patients feel nasal obstruction, however. Doctors see a wide-open nose on examination. Imagine a crowded room. Now imagine everyone suddenly leaving. That feeling of emptiness and vastness is similar to what ENS patients experience, except it's happening inside their nose. This constant sensation of nasal obstruction can be incredibly distressing. It significantly impacts quality of life. Sometimes the inferior turbinates become enlarged. This can happen due to allergies, infections, or other irritants. When the inferior turbinates are enlarged, they can block airflow through the nose. This can make it difficult to breathe. In some cases, surgery may be recommended to reduce the size of the inferior turbinates. This is usually done to improve breathing. However, removing or reducing the inferior turbinates too much can lead to problems. This is because the turbinates play an essential role in nasal function. When too much turbinate tissue is removed, the nose can become too open. This can lead to a feeling of dryness and irritation. This is paradoxical. The surgery was initially done to improve airflow, but removing too much tissue can cause more problems.
The exact cause of empty nose syndrome is not fully understood. However, it is thought to be related to damage or removal of the turbinates. This damage can occur due to turbinate surgery. As mentioned earlier, over-reduction of the turbinates is a major risk factor. Nasal trauma or injuries to the nose can also damage the turbinates. This can lead to ENS. Certain medications, such as decongestants, can dry out the nasal passages. This can also contribute to ENS. In rare cases, autoimmune diseases can attack the nasal tissues, leading to ENS. The symptoms of ENS can vary from person to person. However, common symptoms include paradoxical nasal obstruction, which is the hallmark symptom of ENS. Patients feel like they can't breathe through their nose, even though their nose looks open. Nasal dryness and crusting is another symptom. The lack of turbinates can cause the nasal passages to become dry and irritated, leading to crusting and bleeding. Without turbinates, the nose cannot properly humidify or filter the air we breathe, which can lead to respiratory problems. Additionally, the turbinates play a role in our sense of smell. When they are damaged, it can lead to a reduced sense of smell and taste.
Unfortunately, there is no cure for empty nose syndrome. However, there are treatments that can help manage the symptoms. Nasal irrigation, for instance, involves rinsing the nasal passages with saline solution. This can help to moisturize the nasal tissues and remove crusts. Using a humidifier can help to add moisture to the air, which can be especially helpful at night. Over-the-counter saline sprays can also help to moisturize the nasal passages. Certain medications, such as nasal corticosteroids, can help to reduce inflammation and swelling in the nasal passages. In some cases, surgery may be an option to try to reconstruct the turbinates or narrow the nasal passages. However, surgery is not always successful and can even make the symptoms worse.
Empty nose syndrome is a challenging condition that can significantly impact a person's quality of life. While the exact cause is not fully understood, damage or removal of the turbinates plays a crucial role in its development. Understanding the role of turbinates in nasal function is paramount. Turbinates are not just useless tissues, they are vital for healthy breathing. Over-reduction or damage to these structures can lead to a cascade of uncomfortable symptoms, including paradoxical nasal obstruction, dryness, and even difficulty smelling and tasting. Treatment for ENS focuses on managing symptoms. Saline rinses, humidifiers, and medications offer some relief. Surgery is a last resort and is not always successful. It is important for patients to work closely with a healthcare professional to find the best treatment plan for their individual needs.